from
We have 180 acres. It's a large terminal. We have probably one of the largest footprints in the Lower Mainland from a terminal perspective.
I didn't realize that it was right up there. And I appreciate that you're working to ensure that Fraser Surrey Docks, which is a company operating on the site, which is owned by Port Metro, is working to keep your bottom line in good shape, and that this project came along and looked like it might do that. And I think, you came before council several months ago, and we hadn't really thought about it very much at all. It was the first time hearing about it, and I think one of the motions that came out of this council was, gee, this doesn't, like, this project's complicated. So we asked that there be further consultations on it and that we hear from the public on it. And thank you very much for undertaking that, because I know after that there were some sessions in Surrey. And of course, since then, this project has taken on a life of its own in a way, and that more and more people learning about it. And I think I would put myself in that situation where the more I learn about this project, the more I realize that I realize it's just not a good idea for that location. It's the shipment of thermal coal through North Delta and down the Fraser River out to Texada Island and on to China is just not. There's too many opportunities for accidents, and so it's not a good idea. In Delta, as was already mentioned, we already have West Shore Coal. We've been working hard to work with them on minimizing the impact of the coal trains in our community. And as we sit here, actually, there is a coal train sitting on the BSNF line between Delta Golf Course and right up through to the pullout on 91. So that's one of their coal storage facilities right now, is right in the foot of the watershed park. And, that in of itself is concerning. The movement of coal through our community already is concerning. And I just can't support another facility where coal will be transported through our community. I'm actually, and in terms of a point of order for this evening, I should have mentioned it before you began, Mr. Scott, because we did have on our agenda the EIA as the topic, and we, as a council, we did not receive a copy of your presentation ahead of time. We just, as you've already pointed out, the environmental assessment is just available online. So I did download it over the weekend, and I've started reading it. To be honest, the level of technical information that you've presented here this evening and for this council, we have not, it should be actually responded to or accompanied by, usually the process is a report from our staff on this topic, which is not scheduled, I don't think, Mayor Jackson, until the second council meeting in December.
A couple of weeks away.
Oh, a couple of weeks away. So because our staff is working on assessing this very hefty document and the implications of it. For example, what would be the implications of coal dust from the cars on our residents in North Delta? Specific scientific data relating to our residents. Thank you. What is the specific data relating to the impact on the nearest schools? On Cougar Creek.
Excuse me, is that data available in the EIA?
Yes, it looks at
No,
the correlate.
it's not.
It is. The EIA looks at the dispersion modeling, and then it looks at the the ratios or the components of that modeling in conjunction with exposure limits. And that's how you end up looking at health impacts in terms of the toxicology components of it. That's what the EIA addresses, and that's what it looks like.
Well,
Thank you.
I guess, we can argue back and forth whether it's there or not. I guess where I go to now are the chief medical officer's reports. And I would put my faith and trust in the results from Dr. Paul Van Binder and Dr. Patricia Daly as our representatives assessing this environmental assessment from a health capacity perspective. So I'm sorry, SNC Lavalin versus our chief medical officers, I'm sorry, but the,
Just on that
words.
point, I must weigh in here. We had a meeting with the Fraser Health, as all communities do in the Fraser Health from time to time. This was last Wednesday, and I asked the good doctor and others at the meeting about this report. Being somewhat, actually I didn't know this report was actually written. You provided it for us through your office. I'm not quite sure how this came to pass, but thank you for sending this to us all. My question of the doctor was based on what data he had to base his remarks upon. And they don't have any data.
that's the issue, Mayor Jackson.
They
They don't have the data. The doctors don't have the data, and neither does SNC Lavalin.
I
think
disagree.
that's, okay. I think what we will do, however, because there have been a lot of things stated in this report that I got today, thank you very much, through Councillor Kanakos, which we've distributed on table. But I think our staff are going to be charged with analyzing these documents, and they will be coming back to us through our staff, including what the health authorities have said. So that, I think, will answer the question that we have before us today.
I have a couple of other questions,
Yes,
Mayor
please.
Jackson.
Mhm.
So, Mr. Scott, given the results from the medical officers and the nurses union and the whole of, Simon Fraser School of Environment has basically stated that the methodology is not what's usually appropriate for a study of this manner, that given all of that, will you go back to the drawing board and undertake this environmental assessment in a proper manner with full consultation?
The quick answer is no. In terms of, well, let me put this into context. We follow a process that's been mandated to us by Vancouver Port Authority, Port Metro Vancouver, and we've diligently followed that process. I think the comments that were made by the health authority specifically came out on the Thursday and Friday, a couple days before the report was released. I would encourage health officials to read the report in detail, look at the analysis in detail, and then we can make ourselves available, to dialogue with them further and discuss the report in detail. We had set up meetings prior to that to have those types of discussions with the health authorities previously. We flew our experts in. We assembled meetings together. There's been a lot of history in terms of what we've tried to do to present the facts. And we encourage people to sit face to face and hear the facts and see the facts. And I think there's been a general unwillingness to look at that in that level of detail. I think the information is contained within there. We've taken a lot of time to look at the information. We've taken a lot of time to compile it. There is a lot of data contained within that report that has been available for over a year. And that is data that has been available to the general public and others to analyze, ask questions, and look at those in all variety of contexts. I think the data supports that the coal can be handled safely. I think the data supports that it will not significantly impact the community. I think that's supported by the fact that coal has been handled in this community safely and efficiently for over 40 years. Coal in this province has been mined in this province for over 100 years. There's just no correlation in terms of the health impacts that have been indicated by some of the health authorities and others, and correlating it to minors, you just don't have that same impact from a transportation component connections. And I don't disagree with Councillor McDonald. I think the real issue is the movement of rail. If you look at coal and you look at the exposure of our project, coal represents probably less than 5% of the total air quality exposure limit. It is indistinguishable. And when you look at the movement of goods, you have to look at rail as a component of that. And the railways are doing and are making improvements in terms of the movement of rail. The transportation industry as a whole accounts for 25% of the greenhouse gas emissions. Rail accounts for 3% of that, only 3%. The other percentages are coming from road. And over that period, and I think I have shared with Council in the past, there's been a 20% reduction in greenhouse gas emissions from rail transport alone. Furthermore, there are continued improvements being made on the rail transportation network in terms of reducing greenhouse gas emissions. Those are the facts. They are out there, they're available, and it's showing consistently that coal can be handled safely, that there are improvements being made on a continual basis in terms of the handling of these types of commodities by rail. There's been significant improvements in reductions in greenhouse gas emissions by rail. This future of the port community is going to rely on the movement of all goods by rail. This is not a coal issue. It needs to be looked at as a port as a whole, because we're looking at whether that be forest products or steel or containers or other components. The total volume of rail will be increasing in this port, and we have to look at that in conjunction of the overall growth and expansion plans.
Well, thank you for that, and I agree that we do need to be looking at the whole picture, the issue of transporting goods by truck and by rail in the Lower Mainland, and the impacts on our environment and on our health. So we agree there. I think where there is a diversion here is around a combination of the results and the methodology, and for us as elected councillors in our community, representing the health factors and quality of life factors for our community, we need to see better data. And what we've heard from those who are experts in undertaking environmental assessments, from both an environmental perspective and a human health perspective, is that to gather that data, there's a methodology that a company or proponent follows that was not followed here. So therefore, what we have is a lack of trust, a lack of confidence in the data presented by SNC Lavalin. And certainly some of the global numbers may be true and helpful. However, some of the specifics relating to North Delta, relating to the environmentally sensitive areas along that BNSF line have not been looked at specifically. And in particular, we know ourselves from our own coal dust monitoring study that was done in Delta that when the results for the canisters within 15 meters of the rail line, there was 30 times the level of coal dust in there compared to the other locations in Tawasin. We've only measured in South Delta, and it's only been for a month. That process and methodology needs to be. We've committed to looking at it again and doing coal dust studies in North Delta. And after having seen the trains resting around 64th and number 10 today, I think I'm very concerned about if there was a major windstorm, what would happen to that coal dust close to that residential area. So all in all, going back to a couple of things then around methodology. So usually there's a terms of reference with input from the community. That didn't occur here. Usually there's the opportunity for submissions to the proponent and or body organizing responsible for the study. So my question is, will Port Metro be providing a website with all of the submissions so that Delta can see what Surrey's saying and Surrey can see what Delta's saying, And I see that Port Metro will be undertaking a separate study relating to First Nations issues and concerns. Where will all that data be housed, and will that be available to the public?
I can't talk specifically to the port process in that regard. This is the stage as to where we're at is being conducted by the port, which means all comments and feedback go directly back to the port rather than Fraser Surrey Docks. What I do understand is the port is compiling a response memo in conjunction with the 30-day comment period, where they will coordinate the responses and summarize the responses. But I can't talk specifically to that. That's something that you would have to bring up and address directly with the Port Authority.
Would you agree that it would be helpful for all the information, for there to be transparency around the information being submitted by everybody over the next 30 days?
Yeah, and I think there has been throughout the entire process. We created a communication and engagement summary. We summarized the feedback. I think the port is having a response memo. I think we've done that consistently throughout the project, and we will continue to do that.
Well, I appreciate that, and I hope you take back to the port my own concern, and I would hope my colleagues would share that there be transparency around the information being gathered, so that we can all see the comments and concerns being raised. Because I think that's the other check in this process is, it's one thing to have academic experts go out and do a study. Where an actual environmental assessment becomes helpful is when there are the questions from the public and from interest groups, and where those questions then are addressed in the report, information's provided, and perhaps mitigation strategies addressed to answer those questions and concerns. And right now, I'm not seeing that, but I definitely would like to. So that would be something that I would be asking for as we go forward, is transparency around where we go from here. So with that, thank you very much, Mr. Scott, for your presentation. I wished I had had the chance to read it ahead of time. I'm working my way through the study itself, and I look forward to our staff report. So we're going to have another round on this one in a few weeks. So thank you.
Thank you.
And I'd like to add, Your Worship,
Yes.
something that's been consistent in terms of our public outreach and consultation. We have no issue bringing our experts and consultants and others to address any specific issues that you have. They can either appear before council and meetings, but we've left that opportunity open to several of the stakeholders, that we've met with. So it is important that people get the facts and get the, correct information when analyzing this.
Thank you, and certainly we will be hopefully taking advantage of that offer. I do want to confirm something which I'm not sure that I heard correctly. Councillor Kanakos, you had said that there was, did you say that there was coal in a train that was sitting idle in Delta today? There was coal in a train.
Yes, I actually took pictures, Mayor Jackson,
Okay.
of several kilometers long, sitting at. And actually, there's a story as well. My husband was golfing at Delta Golf Course and saw the train. I drove by, took pictures of the train, and it's happened several days in a row now. So that's why I know.
So
it's
where's
there.
the train going?
Where's the train going? It's sitting.
It's sitting.
It's sitting, and actually the engines are idling. 3 hours, and it's on a hold, waiting to head out to West Shore, I believe. Would it be, or would it North Van? I don't know.
At Delta Golf Course, I can't say for sure,
But
but
sitting
I assume,
between 64th and number 10 and beyond.
I would assume it would be en route to West Shore.
So it's parked and it's going to back up and then head out. So the question is,
My question was, could I have staff confirm exactly what's happening with BNSF, please, for our next question time? I would also. Let's see. In terms of what we've heard from one sector, I read in the newspaper that Dr. Van Binder was quoted in the press this past week. And he went on at some length, but the operative paragraph I would like to have some comment on, if I could. And he states, and I quote, "There's a lot of community concern," Dr. Van Binder said. "We want them to work with us, and they keep saying no." Is there, I mean, can you explain from your perspective what has happened with the information? I think you touched on it previously, but could you just confirm what's happened in terms of getting information through or not through?
You know, I have utmost respect for the health authorities and their expertise and capabilities, but the reality is that's just not true. There has been consultation, direct consultation. I've met with the health authorities. There have been several meetings directly with the health authorities, specifically talking about this project and discussing various components, such as scope and some of the details. And we continue to remain open, continue to be open and available for discussion with the health authorities if and when they are willing and able to meet with us to discuss the project in more detail.